Dentistry is a small world. The person you meet at a dental society meeting today might be the person who refers you your first big case 5 years from now.
Sometimes it's the mentor who helps you avoid making a very expensive mistake.
Networking is one of the most important skills you can develop as an early career dentist, and the earlier you start, the more powerful it becomes.
A lot of students assume that networking is something you start doing after you graduate.
Dental school is actually one of the best times to start building your professional network because everyone around you is going to grow into different roles in dentistry.
The people sitting next to you in lecture today are going to become your colleagues for the next 30 or 40 years.
Your career in dentistry will be shaped not just by what you know, but by who you know. Welcome to Networking 101, Why You Need to Start Now. This episode was sponsored by Tiro, which provides administrative and billing support tools for dental practices to streamline revenue cycle management. To learn more about their services and see if they're a fit for you, visit tiro.com/EOB and check them out on Instagram at Tiro Dental.
Welcome back to Project Confidence, the podcast where we talk about the real things that shape your career in dentistry. You know, all the stuff nobody really teaches you in dental school.
Exactly. And on our show, we've talked about clinical practice, career growth, mindset. And today we're talking about something that has probably had one of the biggest impacts on both of our careers, networking.
That's right. And honestly, networking sometimes sounds like something that only people who work in finance do at a bar while wearing dark suits and they exchange business cards.
But the reality is that networking is one of the most important skills you can develop as an early career dentist. And the earlier you start, the more powerful it becomes.
So today, we're going to talk about what networking actually means in dentistry, what it doesn't mean, why you should start while you're still in dental school, and the best ways to do it.
Let's start by breaking down what networking actually means because I think a lot of people misunderstand it. The word itself sometimes makes people uncomfortable. It can kind of sound like transactional or corporate, like something that belongs in a business school class rather than in dentistry.
That's right. Networking isn't that scene in American Psycho where everyone's comparing their business cards and obsessing over fonts and paper thickness. It's not about collecting a stack of them or trying to get something from someone.
And it's definitely not about walking into a room thinking, who can help me? Or who can I get something from today?
Exactly. If that's the mindset you bring into networking, then people can feel it immediately. Dentistry is a relationship-driven profession, and authenticity matters. When someone approaches you only because they want something, it usually comes across pretty quickly.
The way we think about networking is very different. It's really about building authentic professional relationships over time.
And the keywords there are over time. Networking isn't a one-time interaction. It's not meeting someone once at a conference and then immediately asking them for a job or a favor.
It's more like building a professional community around you.
Exactly. It's about getting to know people in your field, their experiences, their challenges, their perspectives, and sometimes even their mistakes. Some of the most valuable conversations I've had with colleagues over the years have been the honest ones, where someone shares what didn't work in their practice or what they wish they'd done differently earlier in their career.
And those kinds of conversations usually only happen when there's trust. You don't get that from a quick handshake and exchanging LinkedIn profiles.
Right. You get that from repeated interactions, from showing genuine curiosity, and from being someone who contributes to the relationship rather than just taking from it.
Another thing that's important to remember is that networking doesn't always look like what people imagine. It's not always like a formal event or a cocktail reception.
Some of the best networking happens in very ordinary moments, chatting with someone during a CE break, sitting next to somebody at a dental society dinner, or even just striking up a conversation while waiting in line for coffee at a conference.
Exactly. Sometimes it starts with something as simple as asking someone, where did you go to school? Or what part of your practice are you enjoying the most?
And dentistry is actually a perfect profession for networking because it's such a tight-knit community. Even though there are thousands of dentists, the circles overlap a lot.
Exactly. Dentistry is a small world. The person you meet at a dental society meeting today might be the person who refers you your first big case 5 years from now, or the person who ends up hiring you for your first associate position, or the person who introduces you to your future business partner, or even the specialist who becomes your go-to referral partner for the next 20 years.
And sometimes it's the mentor who helps you avoid making a very expensive mistake, which, by the way, happens to every dentist at some point in their career. And having someone you trust that you can call and say, hey, I'm thinking about doing this. What do you think? Can save you a lot of stress, time, and money.
So when we talk about networking, what we're really talking about is building relationships that support your professional growth. Relationships that give you perspective, create opportunities, and make dentistry feel a lot less isolating.
Because at the end of the day, dentistry may look like an individual profession, you and the patient in the operatory, but your career is actually shaped shaped by the people around you.
Now, let's talk about what networking is not, because sometimes understanding what something isn't can actually make it a lot easier to understand what it really is. Networking is not transactional. If your only reason for connecting with someone is because you want something from them, people can feel that almost immediately, and it's like really uncomfortable.
Oh, it really is. Most people have pretty good radar for that kind of thing.
Right. We've all had that experience where someone starts a conversation. Within about 30 seconds, you realize that the only reason they're talking to you is because they want something like a referral or a job, an introduction, or advice that they're not actually interested in hearing.
And the thing is, it doesn't mean you can never ask for help. Of course you can. Dentistry is a collaborative profession, and people are usually very generous with their time and knowledge.
Exactly. But the difference is whether the relationship exists first. If someone you've known for a while asks for advice or guidance, most dentists are very happy to help.
But if someone walks up to you at a meeting and within the first 2 minutes asks if you can connect them with 3 specialists and help them find a job, that's when it starts to feel transactional. The best networking happens when the relationship itself is the focus, not the outcome.
And another important thing to remember is that networking is not about keeping score. It's not, I did this for you, now you owe me something.
Right. The healthiest professional relationships are the ones where people help each other because they genuinely want to support one another's growth.
And over time, those relationships tend to become reciprocal naturally.
Another thing that networking is not, it's not self-promotion 24 hours a day. You don't need to walk into every room telling people how amazing you are, how many implants you place, or how your practice is the best one in town.
And honestly, that approach can actually backfire because when someone spends an entire conversation talking about themselves, it tends to shut down the opportunity for real connection. And honestly, the dentists who are the most impressive clinically or professionally are usually the least likely to lead with that.
That's so true. In fact, the best networkers that I know are the best listeners. They ask questions. They're curious about other people. They want to know things like, how long have you been practicing? What kind of dentistry do you enjoy the most? What's been the biggest challenge in your career so far? And those questions open the door to real conversations.
Another thing great networkers do is they remember things about people. If someone mentions that they're opening a new practice or that their daughter is applying to dental school, remembering that the next time you see them makes a huge impression because it shows that you were actually paying attention and that you see them as a person, not just as a professional contact.
The other thing great networkers do is follow up. A simple message that says, it was really nice meeting you at the Dental Society meeting last week. I really enjoyed our conversation about digital dentistry. It goes a long way.
Or even sending an article or CE recommendation that relates to something that you talked about.
Right. Those small gestures help to turn a brief conversation into an ongoing professional relationship.
And that's really what networking is about, not just meeting people once, but building connections that continue to grow over time.
Now let's address a question we hear all the time. Should we be networking while you're still in dental school? Because a lot of students assume that networking is something you start doing after you graduate, once you're looking for a job or once you're in practice.
Spoiler alert, yes. Absolutely, yes. Dental school is actually one of the best times to start building your professional network because everyone around you is going to grow into different roles in dentistry.
Exactly. The people sitting next to you in lecture today are going to become your colleagues for the next 30 or 40 years. Some of them will become practice owners. Some will become specialists. Some will become educators. And some will become leaders in organized dentistry or the dental industry, or all of the above. And the relationships that you build early often, and the relationships you build early often last your entire career.
Don't you remember the first day of SimLag, the first day of dental school all those years ago?
I know, right?
And this is something I don't think most students fully appreciate while they're still in school. You're surrounded by hundreds of incredibly talented people who are all going to spread out into different parts of the profession.
Right. 10 years from now, one of your classmates might be an orthodontist you refer to every week. Another might be a practice owner looking for an associate. Another might be teaching at a dental school and inviting you to lecture.
Or running a startup dental company.
Exactly. Dentistry evolves in really interesting ways over time, and the people you start your journey with often become your professional community.
Another thing that's really important to remember is that networking in dental school doesn't have to feel formal or forced. It's not like you need to walk around introducing yourself to everyone as if you're at a business conference.
Most of the networking you do in dental school happens very naturally. Study groups, student organizations, working together in clinic, even just talking with upperclassmen about what their experiences have been like. Those conversations are golden. Upperclassmen can tell you things like what they wish they'd done differently during school.
And the other big advantage you have as a student is that people are often much more willing to mentor you because dentists love helping students.
I think part of that is because every dentist remembers how overwhelming those early years felt.
Exactly. Most dentists had someone along the way who gave them advice or opened a door for them. So when a student approaches them with genuine curiosity and interest, they're usually very happy to share their experiences.
And mentorship can start with something very simple, just asking questions like, How'd you decide to specialize? Or what do you wish you knew when you graduated? What's one mistake you would tell new dentists to avoid?
Those conversations can be incredibly insightful, and sometimes they turn into long term mentorship relationships that shape your entire career.
Another reason to start networking in dental school is that it removes a lot of the pressure later. If the first time you're meeting people in your professional community is when you're urgently trying to find a job, that's going to be stressful.
But if you've already spent a few years getting to know people, attending events, and building relationships, suddenly those conversations feel much more natural.
You're no longer introducing yourself as a stranger. You're reconnecting with people who already know you, and that's a much stronger position to be in.
The first and probably most powerful way to network is to join your local or state dental society.
That's right. Your dental society connects you with dentists in your community, and that's incredibly valuable because those are people who understand the environment that you're practicing in. They know the local referral patterns, the insurance landscape, the practice opportunities, and the challenges that dentists in your region are facing. And that's where you'll often find mentors, potential employers, and long-term referral relationships.
This is such an important point, and honestly, I don't think enough early career dentists take advantage of it. Many dentists like me actually find their associates through their dental societies. When you're a practice owner looking to hire someone, one of the first places you look is your professional network. You ask colleagues, do you know anyone who's a great young dentist looking for an opportunity? And a lot of those connections happen through dental society meetings, CE, and committee work.
Exactly. It's a much more trusted way to connect people. Instead of hiring someone based only on a resume, you're often meeting them through mutual professional connections.
And the advice you can get from the more experienced dentists in those settings is invaluable. Things like how to evaluate a job contract, how to negotiate compensation, what questions you should ask before joining a practice.
Those are the things that dental school usually doesn't teach you. You spend 4 years learning clinical dentistry, but suddenly after graduation, you're making huge career decisions: where to work, what kind of practice to join, how compensation works, whether a contract is fair. And those are the kinds of questions that experienced dentists can help you navigate.
Exactly. I remember early in my career having conversations with more senior dentists who shared insights I would have never known otherwise. Things like what red flags to look for in an associate contract or how production based compensation actually works in real life.
And those conversations can save you from making really difficult mistakes early on.
The other thing dental societies are great for is simply having real world experiences. You'll hear stories about how people built their practices, how they handled difficult situations, or how they navigated big career transitions.
Or how to handle difficult patient situations.
Yes.
Because those first few years in dentistry can be overwhelming. You're making clinical decisions independently for the first time. You're managing the patient expectations, and you're figuring out the business side of dentistry. And then sometimes you just run into situations where you think, whoa, is this normal? How do other dentists handle this?
And that's where having a professional community becomes incredibly valuable.
Exactly. Having people you can ask for advice and guidance helps make a huge difference. People have been through those same experiences and can offer a perspective.
Sometimes just hearing someone say, yes, I've dealt with that too, can be incredibly reassuring.
And over time, those relationships can turn into long-term professional friendships, people you collaborate with, refer to, learn from, and then grow alongside throughout your career.
The second great networking opportunity is continuing education courses. CE is amazing because everyone in the room already shares a common interest. You're all there to learn the same skill or topic, whether it's implants, aligners, cosmetic dentistry, digital workflows, or practice management. So right away, you have something in common with the people around you, and that makes it very natural to start conversations.
Exactly. You don't have to awkwardly think of something to talk about because the topic of conversation is literally happening right in front of you. You can turn to the person next to you and say something as simple as, have you done much of this procedure in your practice? Or, hey, what made you decide to take this course? And suddenly, you're having a really interesting professional conversation.
And what's nice about CE courses is that the people who sign up for them are usually very motivated dentists. They're investing their time and money into learning something new. So you're often surrounded by people who are curious, ambitious, and trying to grow their practices.
Some of my best professional connections have actually come from CE courses because there's often a social component built into these classes as well. A lot of them include group dinners or coffee breaks or networking receptions at the end. And those moments, the breaks between lectures, are where the conversations really happen.
Exactly. Sometimes the most valuable part of a CE course isn't just what you learn from the instructor, but what you learn from the other dentists in the room.
You might hear someone talk about how they implemented a certain procedure in their practice, or how they overcame a challenge with staffing or scheduling or patient acceptance.
Or even just hearing how someone structures their day or runs their practice. Those real world insights can be incredibly helpful.
Another thing that happens at CE courses is that you often meet dentists who practice in different settings than you do. So some may own large group practices, and some may work in very small private offices. Some may be specialists, and some may be brand new graduates.
And that diversity of perspective can lead to really interesting conversations. You start seeing how many different ways there are to build a career in dentistry.
And sometimes those conversations then turn into these long term connections, right? You stay in touch with someone you met at a course, and then you share clinical experiences, and you can refer cases or even collaborate on future learning opportunities.
I've definitely had that happen. I met people in the past at CE courses, and then months or years later, we're still texting each other about cases or recommending courses to one another.
And that's really the magic of networking in environments like CE courses. Everyone's already there to learn, to grow, and to improve their practice. So the conversations tend to be authentic and collaborative and totally valuable. The third way, which students sometimes overlook, is building relationships with your faculty. Faculty often have huge professional networks. Some of them have been in dentistry for decades, and over that time, they've developed relationships with specialists and practice owners, researchers, industry leaders, and other educators all over the country. And because of those connections, faculty can often introduce you to opportunities that you might never find on your own.
That is such a good point because I think sometimes students see faculty only in the context of grading them or supervising them in clinic.
Exactly. But faculty are also mentors and advisors and connectors. Many of us really enjoy helping students figure out their next steps, whether that's finding the right associate position, deciding to specialize, or connecting them with someone who can give them more insight about a particular career path.
And those introductions can be incredibly powerful. If a faculty member reaches out to a colleague and says, I have a student you should meet, that carries a lot of weight. That kind of personal introduction can open doors that might otherwise be very difficult to access.
And those relationships don't have to be formal either. Sometimes it starts with something very simple, asking a faculty member about their own career path, like why they chose academic dentistry and how they built their practice and what they enjoy most about their work.
And those conversations can naturally evolve into mentorship.
Exactly. And from the faculty perspective, it's incredibly rewarding to see students grow and succeed. Many faculty take great pride in watching their former students become successful clinicians and practice owners and leaders in the profession. So when students take the time to build those relationships, it often becomes a connection that lasts long after graduation.
And sometimes those faculty mentors become lifelong advocates for you.
That's right. They may recommend you for opportunities, invite you to collaborate on projects, or introduce you to colleagues who can help you take the next step in your career, whatever that is. And that's one of the most powerful aspects of networking because sometimes it's the people who already believe in you who open the most important doors.
Networking also becomes incredibly important when you own a practice.
Yeah, tell us about that.
Well, one of the biggest challenges in private practice is finding great associates and specialists to work with. And honestly, networking is how I find most of them through dental societies, professional events, CE courses, and referrals from other dentists. When you're active in these communities, you start to naturally meet people and learn about their reputation, their work ethic, and their clinical philosophy.
And that kind of information is critical.
Exactly. When you're hiring someone, it's not just about whether they're clinically competent. You're also thinking about things like whether they communicate well with patients, whether they're collaborative with the team, and whether their approach to dentistry aligns with the culture of your practice. And those are things that you often learn through professional relationships and connections over time.
When you already know someone or you have mutual connections who can vouch for them, that's a level of trust that's already there.
Right. And that makes a huge difference when you're bringing someone into your practice because hiring an associate is a big decision. It's not just adding another dentist, it's bringing someone into your team, into your patient community, and into the culture you've built in your practice.
And when you meet people through networking, you've often already had multiple interactions with them before that opportunity even comes up.
Exactly. Maybe you've seen them participate in discussions at CE courses, or you've worked together on a committee, or you've had conversations at dental society meetings. So by the time you're considering working together, you already have a sense of who they are professionally. And that makes the whole process feel much more natural and much less risky than hiring someone you've never met before.
For me, networking has been a huge boost to my career in a slightly different way. Over the years, networking introduced me to some of my most trusted confidants in dentistry. These are specialists and colleagues that I can call or text at a moment's notice if I have a question about a case. Maybe it's a tricky endo situation or a complex restorative treatment plan or a patient whose symptoms just don't really add up. So being able to reach out to someone you trust and say, hey, I got to run something by you. I don't know what's going on here is incredibly reassuring. And it's not just about clinical questions. Sometimes it's about bigger professional decisions too. Like if I'm thinking about about investing in a new CE course or incorporating a new procedure into my practice or evaluating whether a new technology is actually worth it, having colleagues who can share their real world experience helps you make much better decisions.
That kind of support system is so important because dentistry can sometimes feel very isolating. Most of the time, it's just you and the patient in the operatory making clinical decisions in real time. You don't always have a team of colleagues right there to consult with.
Exactly. In dental school, you're surrounded by faculty and classmates. But once you're out in practice, suddenly you're the one responsible for making that call.
And that's where having people you trust to bounce ideas off of makes a huge difference. Whether it's discussing a challenging case, talking through a treatment plan, or even just getting reassurance that you're on the right track.
It really becomes like having your own informal advisory board of colleagues.
Exactly. And those relationships often start with something very simple, meeting someone at a course, a conference, or a dental society event, and then staying in touch over time. And before you know it, you've built a network of people who support you professionally and help you grow as a dentist. We're also having to talk about this, which is social media, because social media has become a huge networking tool in dentistry over the past decade. Platforms like Instagram and LinkedIn allow you to connect with dentists literally all over the world. You can follow people who are doing incredible clinical work, educators who are sharing new techniques, and colleagues who are experimenting with new technologies or workflows. It's actually an amazing way to expand your professional community beyond just the dentists in your immediate geographic area.
100%. You can learn about new techniques, you can follow leaders in the field, and you can see how other dentists approach treatment planning or practice management, digital dentistry, or even how they structure their teams. And so, in many ways, social media has become kind of like a global study club for dentistry.
And it can also be a great way to start conversations with people you might never meet otherwise. You might comment on someone's case or ask a thoughtful question or reach out to someone whose work you really admire. Those kinds of interactions can turn into really meaningful professional connections.
But there are also some hidden dangers.
Yes, because social media can backfire if you're not careful. Sometimes people forget that what they post online becomes part of their professional identity.
Whether it's in person or virtual, professionalism still matters. Your online presence becomes part of your reputation. Patients, colleagues, employers, and even potential collaborators may look at your social media profiles.
And the impression they form there can shape how they see you professionally.
Exactly. So think about how you want to be perceived professionally, both in real life and through someone's phone screen, because in today's world, those two things are often closely connected.
And if you approach social media thoughtfully, it can be an incredible networking tool.
But like anything else in your career, it works best when it's authentic, professional, and aligned with the kind of dentist you want to be known as.
And if there's one takeaway from today's episode, it's this: your career in dentistry will be shaped not just by what you know, but by who you know.
And more importantly, by the relationships that you build. So start early, be genuine, be curious, and invest in your professional community.
Thanks for listening to Project Confidence. If you enjoyed this episode, share it with a friend or colleague who's starting their journey in dentistry.
And remember to like, follow, and subscribe for more. And we'd love to hear from you. So send us an email with all of your questions, love, and feedback at projectconfidence@gmail.com or find us on Instagram @projectconfidence. Thank you to Tiro for sponsoring today's episode.
See you next time. Bye.
Bye.